Thanks, Bex. Kia ora, everyone. My name is Fee Webby. I'm the General Manager at the Mind Lab. Thank you very much for joining us this evening. This topic is a really interesting one. Obviously, we are about to launch a new program called Leading Change for Good, and this is the first part of a series of panels that we're going to host in the lead up to the program. We're hoping to actually do them all year. And we can tell by how many people have already RSVP'd and who have joined tonight that this is a really interesting topic. So without further ado, I'm going to start this evening with a karakia. So by all means, if you want to join in at home, please do. Oh, now my slides aren't going to work. There we go. Ko te kawa o runga, ko te kawa o raro, ko te kawa ora, ko te kawa ora. I rongo e whakairihia ki runga, turuturu o whiti, whakamaua, kia tina, tina, huie, taekie. Okay, so just a little bit of what we're going to go through this evening. I'll give you a very short snippet about the Mind Lab, a little bit about what our new program is, Leading Change for Good. We'll introduce our panel, and then I'm going to lead with a few questions for our panelists, and then we're going to open it up to you at home, at work, wherever you may be. I think we've got someone also dialing in from Australia. So we'll use the chat function, and we've got Bex and Britta from the Mind Lab who will be managing that chat functionality throughout the evening. So very quickly, the Mind Lab, we began in 2013. Our founder, Frances Valentine, wanted to get children excited about learning again. And so we had 2-hour labs for children that would come into our Auckland lab, and then we rolled those out to New Zealand. And very quickly, we recognised that, in fact, it was the teachers that we needed to upskill. And so we launched a postgraduate certificate in digital and collaborative learning. And we've rolled that out to 5,000 teachers since 2014. Now, more recently, we've moved into another couple of programs, digital skills for the workplace, upskilling people who have recognised that as we've moved from an analogue world to a digital world, we need to upskill them as the tools change. And then more recently, at the back end of last year, we had an insight from our teacher program that, in fact, leading change for good was an area that New Zealanders across all sorts of industries were becoming very, very passionate about, but in fact there wasn't a program to help them. So we've now launched Leading Change for Good. So Leading Change for Good, just very quickly, is very much a program that's been designed for people who are very driven by purpose and driven by wanting to make great changes within their community. So this might be people in charities, non-for-profit, iwi, they may be sitting in a corporate, they may be in sustainability team, for example. And so this program is a 34-week program, but it's what we call part-time, which essentially means that you can do the program on top of a day job. We look at tools and frameworks that allow you to build towards a strategy where you can implement change. So that is focusing on disruption, leadership, sustainability, and authentic value. And throughout that process, the candidates will identify what good means to them and what authentic value means to them. And we'll have intakes kicking off in September and November this year. So we are literally about a week away from going live with our applications. So we'll have 40 places in each of those intakes. So those who have signed up tonight will automatically get that email to let them know that the applications are open. Okay, let's jump in. So you all know me, Fee, the General Manager at the Mind Lab. I'd also like to introduce Dr. Mandy Lacey. So Mandy, maybe if you can pop your hand up, take yourself off mute for a second and say hello.
Hi everybody. Great to be here. Yeah.
So very quickly, just about Mandy, she's an experienced consultant, facilitator, workplace educator, professional development coach and mentor across many sectors. Her teaching and education services are based on experiential learning methodologies focused on leadership, change, dynamics and communication. And Dr. Mandy Lacey is our program lead on the new program, Leading Change for Good. We also have Dr. Will Reedy. So Will, I'll ask you to pop your hand up, take yourself off mute and say a quick hi too, so that people know who you are.
Hello everybody, nice to be on the session tonight.
Fabulous. So William is passionate about improving health outcomes for digital health. He has over 20 years experience in digital health consulting solutions experience across New Zealand, Australia, Asia, North America, UK and Europe. And lastly, but certainly not least, we have Preeti Ambani. So Preeti, I'll get you to take yourself off mute and say hello as well.
Hi everyone, kia ora, pleasure to be here.
So Preeti is an engineer, an entrepreneur and an educator. She has led initiatives and startup ventures that leverage the dynamics of digital collaboration and emerging disruptive technologies to create thriving societies. And Preeti is the Innovation Director at Tech Futures Lab. Thank you, everybody. Okay, so what we'll do is I'll actually take myself off sharing so that you can see everybody as they start to answer their questions. So what I want to do now is just for all the panelists really to, maybe we'll start with Preeti. Preeti, you're right in front of me, to really just spend maybe 2 minutes saying what you're doing and a bit of background of where you've come from, your journey.
Thank you, Fee. Thanks for having me. So Preeti Ambani, I'm the Director of Innovation at Tech Futures Lab. We are New Zealand's graduate school for human impact. So proud to be on that journey for the last 4 years or so. Prior to that, I have a background in engineering, so trained as an engineer. And lived in the States for 14 years before moving to New Zealand. I was born and raised in Mumbai, so quite a global perspective on things. So my career started in engineering, and I did the sort of usual grind working with mega corporates, the likes of the Walmarts and Costco's in the US, doing work around their energy and engineering capabilities, but just felt that at that point, hindsight 2020, that this was not it. I just needed to expand my horizons and do different things, and that kind of led on a lifelong journey of learning, relearning, experimenting, trying different things. But I think the common theme that just is a common thread across all of the things that I've done is I think I've found meaning in bringing good, whether that's from a business angle, from community angles, or just creating thriving futures with the impacts of my work. So that has been quite a common thread. And I think what I'm really motivated by is the fact that what kind of legacy I will leave my kids. So what will they think about their mom having done something that has impacted the world? So that's something that's really drives me. And so, a career, through startups, emerging technologies, collaboration, the power of platforms. I firmly believe, just being embedded in technology and new business models and things, I firmly believe that with great power comes great responsibility. And I'm a keen champion for that kind of change. So thrilled to be here. Thank you for having me.
Kia ora, Preeti, thank you. And Dr. Will Reedy, over to you, a little intro and how you've got to where you are today.
Yeah, great, thank you. So I guess my background is digital transformation and disruption of health systems around the world. I trained as a medical doctor in the late 90s. I'm showing my age online right now, and continue to work as a doctor 1 day a week in the hospitals here in Auckland. And I guess that provides me with an interesting perspective on disruption within the health sector, particularly post COVID-19. But essentially, I was training to be a surgeon in the late 90s, apparently saw the light and moved into digital transformation and disruption. It's fair to say in the health sector in New Zealand, we're behind the rest of the world. So I did a lot of my work overseas in large health systems like the NHS in England, British Columbia, Singapore, all of Australia, and returned home about 3 or 4 years ago to work within Spark on a startup called Spark Health, which we'll talk about, I guess, during the course of this evening. So my passion is health system transformation and disruption. I think we're going to have a chat about the difference between disruption and transformation during the course of the evening.
Kia ora, Will. And Dr. Mandy Lacey, over to you for a quick intro as well.
Yeah. Yes, thank you. Yes, I've always been interested in new things, but I've also been interested in groups. I've been fascinated in my own family stories. My first thing that I did is I went on to nursing, and I was always fascinated in how leaders got people to do things. The same within sharing gangs, I might add. So I've always had that going on in my world around having that fascination in terms of doing organisational psychology, but ending up doing learning science and technologies, but also being connected in terms of the health services. So like Will, have noticed that for some reason there's kind of an anchor going on around why the health services aren't as up to date as perhaps others. But yeah, so I've taught in I've been really involved in workplace learning and using digital tools, involved in change and transformation projects, of bringing people on the journey. And it's a thrill to be here as part of the Mind Lab.
Kia ora, Mandy. Okay, so we're going to jump into the questions. So I've got a rather large one for you just to kick off with, just to get us all going. So what is disruption to you? So maybe just have a think about, defining it and, yeah, I guess through the lens of your profession and your past. So maybe Preeti, let's kick off with you.
That's a great question, Fee, and I'm just kind of thinking in my head, where do I start? So, disruption for me, I think, coming from an organization that's called Tech Futures Lab, the immediate response to that is technology-driven disruption. But I'd love to sort of take a step back and say, disruption is not taking the easy path. And sometimes we think about business and we think about technology and we think about all of the things that we are doing to create impact. But we can take the easy path, which is not being mindful of communities, not being mindful of the impacts of what we're doing as a business, not being mindful of the sort of second and third degree impacts of what we do. And so for me, in a sense, disruption is not just, new thinking, new technologies, new business models, far-fetched ideas. Disruption is also making sure we are mindful of the impact we have on our environment, mindful of the impact we're having on society and communities. So I think real disruptors today are going to be, who are applying technology, who are applying all of these amazing things that humans are doing in the context of our most pressing needs. So it's fascinating to see that happen on a wide range of areas. There are companies now that are at the forefront of open innovation, open source, bringing ideas to everybody. There's people who are thinking about, tools like AI, blockchain, to make sure it's an even playing field, to make sure that when we are designing technologies, we are designing with the most vulnerable group in mind. So for me, this is real disruption. This is not just using technology for technology's sake, but actually making sure that our most urgent needs, our most vulnerable people are taken care of. So that for me is, I think the real disruptors are if we look around and find the people who are actually creating impact with pushing the boundaries.
Great, thank you, Preeti. And Will, over to you. What does disruption mean to you?
I agree with everything Preeti just said. I think there's a very common thought that all disruption has to be digitally enabled. I guess that is going to be the main way moving forward when you think about leading for disruption, and often it is thinking about new business models. I agree around thinking about the social impact. I think around diverse and inclusive teams in terms of leading disruption as well. It's certainly something we're doing at Spark, and also thinking about inequity, because often when you talk about digital, you actually, in healthcare in particular, you drive some further inequity between the haves and the have-nots. And I think for those of you who are joining us tonight, I think during COVID, it was worked out, there's about 200,000 households here in New Zealand that don't have any broadband connectivity. So as soon as you went to virtual services, there's 200,000 homes that couldn't actually get access to those, even though they were confined to their homes during a very testing period. I think the other thing that's we're thinking around disruption is it's not something I think exists in New Zealand in terms of leadership or experience in it. And I guess where I'm coming from is if you go around, and I'm using a bit of a health lens here, and ask and sample vendors or healthcare providers or even some of the entrepreneurs, they don't have a whole lot of experience or mentors in this disruption space here in New Zealand. So often you're having to look overseas for some of that experience. So that's the only other context for me, in addition to what Preeti had to say before.
Thank you, Will. Mandy?
Yeah, I think of it in 4 ways really around disruption. I think it can be through our own choices, life choices, what we do in terms of disrupting how we operate, how we do things. I think there's disruption that can be forced upon us, like we've all just experienced, but also in terms of, you know, when we're in workplaces or things change, workflows change, and that can create a different response to disruption for us. I think it can also happen through our own awareness around, like socially, like when we think of environmentally, financially, you know, we can disrupt the way we do things, or things can get disrupted for us in terms of that we might want to be more environmentally friendly, or that we make choices around that. And also, of course, through innovation. Like, we don't know what we don't know. So things come along, and, you know, I think we're all pretty like it in terms of, we think of our phones. We don't know half of the functionalities that go on in our phones. Maybe our grandkids or our kids tell us about them. But, you know, so that can be kind of a soft disruption. I think there's a soft disruption around what we choose to do. And then there's the hard disruption around what gets forced on us around, like, say, lockdown, like, say, we're in a workplace, restructures, new technologies come into place. So, yeah, I think there's kind of different kinds that are happening all the time.
Yeah, that's a really nice way of looking at it. Thank you. Now, another question for all of you to go through and answer is, what is your experience of disruption for good? And I'd love you to touch on things that worked, and also maybe things that didn't work, or that you found, you know, you personally may have had a gap, or the business that you worked with had a gap. And yeah, just if there was any particular domino effect that maybe you experienced. So Preeti, we'll kick off with you again.
I think for me, Fee, the key thing, you know, what I've realized over my life and career is that, you know, disruption can come from anywhere. For disruption for good, the impact can be a single person, right, creating impact, and it doesn't have to be this this mega force, or this mega investment, or a large scale project, or you know, a big corporate with a massive team or resources. And I think that has what has empowered me, that I, in my own sort of right, can make that step change. And I think that has been quite useful to kind of think through. And that's why I kind of love this Leading Change for Good program, because, you know, all the things that over the last, you know, after I sort of quit my engineering job and started sort of exploring what else I could do. And that's been about 11 years in my career. And this has been, Fee, almost something that I had to sort of put one foot in front of the other and learn as I go, right? There wasn't something that I could look around and a Leading Change for Good template and a toolkit that I could access and then leverage and use the frameworks, or use that thinking, or, you know, have this inspiration. So it was almost like you had to do that. And I feel like now, the thing for me is actually, how do I learn off of the mistakes of change makers? How do I learn off of experiences of others? And I think that's such a powerful thing, right? In this day and age, in this age of technology and connection. And I think for me, that is where what I would love is my toolkit is, I don't want to make the mistake that this person has already made. I make new mistakes, right? But let's learn from the mistakes of others. And so that's apt in business, but it's even more necessary and important when we're doing and embarking on projects for good, is actually, how do we, you know, short circuit that journey to impact? How do we create those shortcuts by learning from others and being part of a collaborative ecosystem? So I've really relied. So that's about my personal toolkit, is actually relying and collaborating and working with others, and actually, you know, developing this toolkit as I go. But unfortunately or fortunately, of course, it's part of my journey and learning. For me, it has been like, you know, just taking that step at a time and learning that. I'm hoping this program that the fabulous team at the Mindlab has come up with is going to help change makers kind of accelerate the impact. So yeah, that's.
I really like how you touched on that, you know, anybody can be a leader, and change can come from anywhere, because I think you did right that it is easy to think that change or disruption is big, but actually it can be the small things, the small incremental changes that we can make that can impact great things. So yeah, great, thank you. And
Just
Will,
to
your
add,
version of that? Oh,
sorry,
sorry.
just to quickly add on that is just, like I remember sort of one of the first projects I did was basically take the sustainability curriculum for a non-profit called No Impact Curriculum, which was basically environmental curriculum and kind of just marketing that to schools across the States. So it was such a small thing, but it was just one thing that I could start doing.
Yeah, yeah, start somewhere, definitely. And how about your experience, Will, in terms of your disruption for good and what's worked and what hasn't? What's in your toolkit?
Yeah, I'll probably just talk about, I guess, what I've been doing the last 20 months within Spark. And I think the best way to describe the disruption is many of you experienced Spark Sport last year. You see with a smile. And I guess that was an example of a play by a traditional telecommunications company getting into sports broadcasting effectively. And some of it went well and some of it didn't go so well on the first night. But ultimately, that was a disruptive play in terms of getting New Zealanders to go to online sports streaming. So Spark Health, which many of you haven't heard of, we've been a startup for about 20 months. And the analogy is we're a little tugboat in front of the container ship that is Spark, the telco. And we're trying to get them to transform and disrupt into vertical industries. And they chose health, the most fragmented, least digitized vertical you could choose in New Zealand today, as the target for disruption. And really that disruption is not just disrupting the market in terms of yourselves as, I guess, Kiwis consuming health services, but also all the providers from, GPs and pharmacies all the way up to St. John Ambulance and the large hospitals that some of you may have touched in the past. But actually the disruptions happened in Spark. We aren't a digital services company. So I've had a team of 4 of us who've disrupted what Spark have done for years and years and years and moved into a health vertical and built a business over the last 21 months to the point that, I don't know if this is a good thing to be sharing, but we'll be the next Spark Sport from September. And we'll be offering digital services to everyday New Zealanders on mobile phones and into your homes through residential broadband. And obviously been looking to connect Kiwis through to healthcare providers who hopefully go on a digital journey. So that's what I've been doing for 21 months. The interesting thing, it's never been done in New Zealand before, but it's stuff I've done overseas, particularly in Australia when I came home a few years ago. What were the challenges? The challenges are a board and an exec team who only understand telco and don't understand what a digital services company and how you play in a vertical. So what we did that was very different is, and when you get into public sector companies who want to disrupt and to a degree transform themselves, they're very focused on revenue, EBITDA and earning per share, right? They're very focused on what happens on the stock market. What we did differently around disrupting for good was we set metrics around improved health outcomes. So looking at inequity, improving patient safety, improving patient experience. The other interesting thing with our aging workforce here in New Zealand, I think an interesting stat to share with you is the average age of GPs is 55 now. So the other thing you need to do is provide, I guess, clinical satisfaction for doctors, nurses, and allied health professionals. So our piece there was just setting different metrics to measure how good our disruption was progressing over the last 2 years. One of the questions here is, were there gaps in your capability to lead this change? I'm not sure there were gaps. I just probably underestimated the communication I had to do internally. I probably needed to hire an internal comms person about what we are actually doing. And it's just those simple messages around why we're disrupting and what our end goal was. What's the domino effect of the change we've made? Well, I think if I was to think about an example of doing good, one of the things that actually just went out in the media today from the 3 telcos is we've started to work together. And one of the things we've done is something called sponsored data. The simple way to explain that is if you're on Spark or Skinny or Voda or 2 Degrees and you consume the COVID-19 website or GP portals or mental health websites, but you guys probably understand the context for that, you don't get charged for the data. The domino effect was it was quite easy to convince the board and the other telcos to work collaboratively on not charging for data since actually when we went to level 4 back in late March. So that's just one pragmatic example of having a disruption for good kind of North Star focus strategy, and then how you can start gaining some further benefit from that. The other interesting
Fantastic to hear about that collaborative aspect of big telcos coming together for good. 'Cause you know, telcos can be hard to shift, so that's wonderful outcome.
Yeah, it was a great outcome. It wasn't easy, but
Yeah.
it's one of those things where, you know, something like COVID-19 drives some behavioural change, some social good, so to speak, or corporate responsibility. So that's led on to some interesting stuff for all three telcos working with the government. As the wage subsidy comes to an end, just to share some context, we're looking to work with the government to provide free residential broadband to the end of the calendar year, just to keep everybody connected when it's potentially a difficult time for a lot of New Zealanders up until the end of this calendar year. So just some, I guess, pragmatic examples of what we've done in Spark Health around disruption for good. Some of the challenges, which many of you nodding, I can see. Imagine a telco trying to get into healthcare is quite a big ask in the first place.
Oh, and I also loved that you shared about the stakeholders as well. I think many of the people on this call will be aware that, you know, when you do go on that journey of change, or any project, that stakeholder management is just so important to be able to get people, I guess, up to speed and take them on that journey. So, yeah, great to hear that. I guess a reminder to us all when we're doing projects and leading change to take our stakeholders on the journey. Communicate.
The last bit to jump in on, sorry, prior to you, Mandy, is, and Mandy will understand where I'm coming from here, is when you think about disruption, and I get a very health-focused lens on at the moment, is will it happen in the Ministry of Health? And I think the answer is no to that. They're a traditional government department. Will it happen within the health sector itself? So I'm talking GPs, private specialist hospitals. Maybe in some parts. The ministry pays about 6,500 providers, very fragmented sector every year. And so you're never really going to get those guys to transform or disrupt unless really challenged. So really where a lot of the disruption in healthcare is going to come is from us, everyday Kiwis, demanding a different experience or a different level of service. And certainly COVID-19 put a little bit of a lens on that. So again, a lot of our focus around disruption for good is actually on everyday New Zealanders, a little bit on the providers, but more around the health and wellness of everyday New Zealanders is where we think it's going to happen.
Brilliant. Good to hear. And Mandy, your experience of disruption for good, what worked, didn't you?
I could segue into what Will has said 1,000%. But I'll come in from another sector of an example of leading change for good from a group of people is when I was a general manager in a disability service, and when disability services were set up as sheltered workshops. So it was at the end of 1999, 2000, and the New Zealand government came out with the Pathways to Inclusion and the new disability strategy. But what we did as a group was we had an orchard where lots of people with disabilities were part of in terms of the sheltered workshop. But it was about leading out, being organic. And so why I've thought of that, like I've written down lots of examples actually, but why I've thought of that is that whole thing, and linking into what you're saying, Will, is around governance structures that are set in ways. So like, say, Ministry of Health, like primary health organisations. So it's interesting around when you start introducing a whole reason as to why the disruption is important about people's health and sprays, all that type of thing. So, I mean, that's just one example. But the other thing that I think is interesting is when we think of, say, stakeholders, and a piece of research that I did around patient education technology enhancing patient, what they call efficacy, so patients' confidence around being able to manage their own health. So what we found is that if you provide patient education that is not written in academic or medical speak, that it's written in lingo that we can all understand, with various interactive things around understanding, say, their diabetes or this or that, you get a lot more engagement from people that are either socially, emotionally, geographically isolated. So, in terms of the disruption, just linking into what Preeti and Will have both said, I think the disruption, the groundswell of disruption is happening from what we, the people, want as well. So I think there's sort of several prongs to it. So I could go, there's lots of things I could talk about, but another thing that I think is really important around disruption is constantly doing lessons learned. you know, I really think it's a really effective intervention at every level to go at, well, what have we learned from, you know, when we think of iterative or agile ways of working now. So, you know, moving very much from, you know, health, you know, working from waterfall to agile, you know, or having hybrid ways of working. But it's like, well, how do we do regular? What are we learning from that? And I think that's a big part of disruption is, you know, what mistakes did we make? Where did people vote in terms of consumers? Those sorts of things. So I think it's been very on point and very aware and very in touch with, I think, is what disruption is about.
And also I'd probably add to that, I guess, the timeliness of them. So I think traditionally it's very easy when you talk about the waterfall model to wait too long almost for that feedback. When you think about agile and I guess sprints, of being able to get that feedback and feed it into the next phase of the project that you're working on. We had a little example last week where we had a new program called Hey Future for 18 to 22-year-olds, and literally at the end of every day we were asking the students to give us feedback on how they were going and how the program was being delivered, so that in real time we could tweak things, because it was the first time that we'd delivered it. And a great learning for us to be able to do that, and then again at the end of the program, and then have a bit of a month and then do it again, just to see where that and how things have sunk in and changed. So yeah, thank you, Mandy. Okie dokie. So now I've got a question for you, Preeti. Does disruption for good always mean more expensive or not to make profit? And by all means, Mandy and Will, if you've got answers for this one too, jump on in. But we'll start with Preeti.
Another great question. I think, you know, multiple aspects of that. So I think when you think about anything, and whether, you know, whether that's a business, whether that's a project, a community, whatever that might be, I think there's a short-term lens that is easy, that is that we can look at, that is, you know, that's where what we incline to, the short-termism, where, you know, we're not thinking about the second order impacts or third order impacts. And there's a lot in there when we're taking sort of the easy route to doing something. And those typically seem cheap at first, or, you know, inexpensive or easy things to do. And there's a human tendency from inertia and all of that, right, to take that easy route and to actually do that inexpensive, the here and now, the short-term benefits, and not look long-term. And what I think is the key thing that we have got to understand now is things cost what they cost. Either you pay for it today or you pay for it in 10 years, and you pay for it like, you know, tenfold, because the impacts and the damage that that's doing to society or the environment or to our people is going to come back to bite us. So either you pay for it today, or you have the next generation pay for it, or the, you know, future generations pay for it. So that's where I really think, you know, we've got to be thinking about the long-termism, right? And I love the Kaupapa Māori philosophy around that, is we're not just thinking about our generation, but we're thinking about future generations. And I love the sort of recent, or actually a couple of years ago, that the Welsh government has actually put into practice a philosophy or a policy check, like, you know, any policy that's being passed, it's not just good for our generation, but also for the well-being of future generations. So that's something that we've got to be thinking about. So I think the whole notion of whether that's cheap or expensive is actually thrown out of the park, because I think if we look at it from a long-term systemic view, we'll realize that doing the right thing is going to be the cheapest. And so I think we've got to really think that through and understand. And if we actually, you know, build in, so from my environmental engineering days, we realize, you know, that and something that I practice today as a sustainability specialist is, you know, that nature's services, or natural capitalism, nature's services are not costed. So we think about nature being this giver of services that we're not really paying back. So we assume all of what nature does for us is free. And so you know, that kind of finds its way on its balance sheets. But if we actually put a price to, you know, how much would it cost to actually replicate what a tree does for our ecosystem? Oh my gosh, we'll definitely price our products right if it, you know, sort of taking down forests or, destroying ecosystems or destroying biodiversity. So it's just a very narrow-minded lens. So I think it's actually not a question anymore. We can't afford to be thinking about, we've got to be, whether something is more expensive or cheaper, we've got to be doing the right thing.
Beautiful, great answer. So question for you, Mandy. How do you plan and prepare for working with blockers?
It's a great question, isn't it? Yeah. I can't help myself. I just have to sort of add something to Pretty in terms what her comment around the whole finance, and I'll come back into that, is that because benefits is something that I'm exceptionally passionate about, and it is when you think about costing things out, and it is around blockers or people that resistance is a word, and I think it's actually a normal human function to feel relative resistance around different things, but the thing around measuring it is really important. So it's like when we baseline things, what's the current cost? What's the current goings on about things? So that when we plot and plan around disruption and the whole disruption management, change management, if you will, how can we measure it? Like, how can we know that we're making a difference? And we always know that when we go into launching something, communications is exceptionally important, but there'll be a dip. Like, every model is the same. It has a dip that goes down. And that's where you could perhaps put blockers or resistance or people that feel overwhelmed or, like if you think of lockdown, how we all had a personal experience to that. We're all the same really in how we experience, and some of us may be further ahead than others because we might be leading it out, and then we've got to look back and go, well, everyone's just starting on this journey and they're now in the resistance or blocking or denial phase of things. So my thing is around have an awareness about that there's a journey of change, a journey of disruption. Think about how we're going to measure this. Think about the human aspect around what are people's reactions going to be and how can we actually be proactive about that. And 9 times out of 10, if we think of our own experience of change or disruption, whether it's, the soft, something we've decided ourselves, or the hard, it's been done to us, like what has been our own experience about that? And 9 times out of 10, what it is, we want, we want clear communications about things. We want to know stuff. So I think with people, with those that struggle, and we've all experienced people that actually do their darndest to be a great resistor. And so sometimes they're better close than far away. Bring them in, try to understand their situation, understand what it is, their thinking, those sorts of things. So you'll get people on different polarities about that. But I think it is keeping the communication going, keeping communication up, keeping people in the circle. There'll always be those at that end that you're never going to turn. But I think they're a minority. But the thing is that people's reactions to change will always incorporate that around having, and if you think, I just think of myself around, if my phone fell in a glass of water tonight and I had to get a new phone, like I would go through a bunch of resistance and frustration and a whole lot of things about having to learn something new, so I think it's just keeping in contact, keeping the context, really transparent for people.
I really like how you said that about that journey as well, that to be mindful that people will be on that journey at different times.
Yeah, because I think those of us that have been in leadership roles, or those that aren't, like we're in the fellowship, when you're in the leadership, you can think, well, how come, where is everybody? Or how come they're still resisting this? But actually, when we think back, they've only just been introduced to it. And it can be a bit difficult, but I think it's keeping in contact in the communications.
Great.
Yeah.
Thank you. Now, question for you, Will. How can staff labelled as disruptors hold their leaders accountable?
Yeah, interesting question. So I think it's quite interesting in terms, and I'm going to use Spark Health as an analogy again here. I think one of the things when we set up Spark Health is we looked at some critical success factors, and we talked a little bit before around governance or reporting line. And essentially we were quite careful in choosing a leader within the Spark leadership team and a key member of the Spark board as the people that kind of got what we're about to go and do. And I joke within Spark, there's 5,000 of us, so I have to wear a full metal jacket some days because we are leading disruption from within, and we're also trying to help transform and disrupt the health sector. So I guess the key thing that we did from a leadership point of view is kind of set the vision and strategy by talking to leaders in the health sector. That gave us some credibility to go back into the board and the leadership team to say we need this type of board leadership and this responsible board member and this responsible executive in the team to provide the governance and the reporting line, for want of a better description, to allow myself and my very small team of 4 to lead out some disruption and just let us be agile and entrepreneurial as we approach the sector, which is very unlike Spark. So that's, I guess, the key element for us was just we had, I guess, the right team and leadership within Spark Health, and then it's just making sure we had air cover in terms of the journey we're about to go on, and running interference when we veered away from what, in my words, I'm going to use now, the mothership was used to doing, and went on our disruption journey. So that's probably been the key piece around leadership in terms of right governance. And then, and I think there's a question coming up around building the right team. It's quite important when you're looking at disruption to have the right team. And just to give you a sense of it, we're about a $200 million company now, and there's 5 of us. And usually it's 10 times that within Spark on a good day, running similar sized businesses. So we're very different in terms of how we roll, how we operate, and drive that disruption moving forward. So
yeah, awesome.
So we're all external hires, interestingly, from a disruption perspective.
Oh, right. So no one came up, the Spark ranks.
From the start, we all kind of started the journey 20 months ago and came in as external experience, if you like. Yeah.
So were you abroad and came back to New Zealand for this role?
Yeah, for my sins, yes, I did. Yeah. Came back and yes, similar to Mandy, there's a real opportunity compared to other countries to really improve health outcomes here in New Zealand, and digital's got a big part to play. So that's, a big reason why I came home a couple of years ago.
Yeah, fabulous. Now, question for you, Preeti. What are the key skills and tools you need to disrupt for good?
I'll talk from my perspective on what's actually helped me. So I think, one of the key things that I think is really key when you're trying to create any sort of impact is having a systemic view of the problem or the challenge that you're trying to solve, like a systems view. And I say systems view because a lot of the For Good work, and I'm sure Will and Mandy will agree with me, it's not a black and white kind of situation. There's so many complexities, there's so many things, there's so much gray, right? And just being comfortable with not having the clear answers. And so having a really good systems view and learning systems thinking, if you're not already sort of on board on that piece of tool and mindset, is to have that systems view and look at different perspectives. So that's something that I've always tried to do with any sort of project that I've worked on, whether that's Next Billion to enable women-led businesses around the world, or working with the Southern Initiative and Up South on enabling our rangatahi and young people to basically express themselves and earn money and just create a thriving future in the digital economy, or the work that I'm doing currently with Tech Futures Lab, or Project Moonshot City around developing ideas for regenerative cities. I think the big thing is looking at systems view. The second thing,
what does that mean in layman's terms, the systems view? How might people listening take that into their everyday practice now?
So it's really understanding what these wicked problems are, because it's not a cause and relationship type relationship in most cases. There's multiple factors that affect it. So if you take the example of child poverty, there's a lot of different factors that impact that, right? So it's not just, oh, we'll fix this thing over here and then that's going to fix that problem. It's a systemic view of the challenge that you're trying to solve. So there are some things that, you know, affect it directly, but there are a lot of indirect factors that impact that particular thing. So understanding what are the different, you know, the different elements that are impacting this type of problem, and understanding what are the levers that if you basically work towards, or the interventions you're making are going to then have an impact. So I think that's essentially what I mean by systems view. But also the second thing is, what has worked for me really well is not just looking ahead. So I have the futurist hat and I look ahead and I look at technologies and new things, but I also want to look behind and look at, you know, indigenous thinking. What does my culture teach me? What do my, you know, ancestors have done to solve those challenges in their time and age? So I think, you know, having sort of that dual vision, looking ahead, but also looking behind, has been super useful in my context. I don't know if you've lost Fee.
Oh, have we?
We might have lost Fee. She has frozen. That's okay. We can move on to the next question because I've got them here. So this next one is for you, Will. So
Brilliant. Thank
there she is.
you. You lost me. Oh,
You're back.
oh, am I here?
Yep, you're here.
No. Hopefully
Maybe
you can hear me now.
Okay.
So, do you want to ask the question in case I cut out again, Britta?
Yep, that's all good. My question is, next one is for Will. So yeah, it's that team question. So what team did you pull together? What skills were you looking for? And how did you balance a business head with your sense of purpose, or your clear purpose?
Yeah, so yeah, we touched on this a little bit before. So I guess there was one element of New Zealand's health system is ripe for digital transformation and disruption. So when Spark went looking for somebody, they wanted somebody with that kind of experience at a, I guess, using previous description before, at a health system level. So just thinking about the health system as a whole, so the 5 million Kiwis and the 6,500 providers. And they wanted, which is really interesting to share with you guys, is a lot of Spark's general customer interactions are with technical people. They don't talk to business executives, they don't talk to clinicians, they don't talk to boards. And so when you're driving disruption, you can't talk to technical people. You actually got to talk to the business owners, and in healthcare to some of the clinicians, and ultimately patients and people as well. So that level is where they hired me to do that role. And then below me, we just needed some expertise around delivering things at scale, projects at scale. So again, in Spark, there weren't people who could think at a systems level for the whole of New Zealand and deliver large scale projects. And then we wanted somebody who could bring together various digital solutions. And the other person we wanted was, if you like, a comms and marketing person that understood the health sector. So those were all people that didn't exist within Spark, but were core to being successful in terms of the four of us. And the only other thing I did was I brought a salesperson on, because we have to get in front of our customers and offer them services that help disrupt what we're delivering across the health sector. Spark actually went agile about 18 months ago, and we're aptly known as the Spark Health Squad. And that's because we're really small, but we're a cross-functional team that work in an agile way, and we pivot quite a lot. So a really good example is COVID-19. In a word, was a nightmare for us because we're a lifeline utility. We had to deal with the coronavirus line on level 3, level 4, I should say. Back in March, you can jog your memories back that far. Home Care Medical, who run the coronavirus line, went from 500 phone lines to 5,000 in 2 days, and that required some certain skills to do that. And then I'm not sure how many of you have downloaded the COVID Tracer app, but we had to make that work. Help desk 0800 number, security, data stored in Australia, all that type of stuff. And so that required all 4 of us to get across it and be agile. And none of us, it was planned from our perspective, but we needed to help just transform and disrupt, I guess, from a contact tracing perspective. Yeah, clear purpose is quite interesting. One of the things I will share with you, which again is unusual, but when you think about pulling a team, and it's all about the team, right? Our ability to help execute and disrupt with Spark Health, it's all about the people. So if I'm ever asked, you know, what's your secret sauce? It's a little bit of a vision and strategy, but it's the people, right? So if you can't get the team right, you run into a lot of trouble pretty quickly if you're passionate about disruption. So one of the things that's really interesting that we've done, and it's the first time I've done it, is we actually got a high performance coach in who focused on our strengths. And for those of you who've been in various roles, you often get caught up as you're developing as a leader to work on your weaknesses, right? But basically we have a strengths matrix across the 5 of us, and we're about to hire another 15 as we grow, and we'll be using strength-based high performance coaching to drive our clear purpose and to make sure we're performing as a squad moving forward. So that's very unusual, but for us to be successful with disruption, I really wanted to make sure we had complementary strengths across a diverse team. So I'm strong in some areas and weak in other areas. Where I'm weak in other areas, I've brought somebody in with those strengths to plug the gap effectively. So that's a different way that we looked at in terms of building the right team. It was a strengths-based approach as well as a cultural fit, which is not the done thing in corporate New Zealand. Clear purpose is quite easy. We went through a whole process as part of that strengths-based piece to have a very clear set of a clear vision, and our vision is really simple: get all New Zealanders healthy with the power of technology. End of sentence, pretty much. And then we have some very clear values and a clear mission that we operate around, and so, you know, integrity, honesty, all those types of things are very important to how we stay true to our purpose. Very interesting term used in corporate New Zealand now, which is we lean in. So we lean into big problems and we're not scared to have a go. So there's some mistakes we've made along the way in the last 20 months, but most of the time when we lean in as a squad to difficult problems, we come out the other end pretty good. And what did I have to shift? Well, I think I kind of covered that before. We were pretty fine as a squad. It was the mothership that was the thing I needed to shift, and we've definitely got there. I guess if you see us as the next Spark Sport from about September this year, it's a good problem to have in terms of shifting that mindset. I think the only thing to share with you guys, which is quite interesting from a Disrupting for Good perspective, is Spark as a New Zealand company wants to have a legacy in health. So it's gone away from that true corporate elements that started 2 years ago to a kind of a 10-year doing good for New Zealand, addressing the digital divide is where it's heading at this point in time. So you'll see quite a different kind of focus from us moving forward. So yeah, hopefully that answers those questions.
I'm just aware of time. We could literally talk about this for another hour, but we will need to finish up. Just wondering, Bex and Britta, is there any particular questions that have come through on the chat for Will, Mandy, or Preeti that you want to throw into the mix before we finish up?
I think one that came through for Preeti, but she's actually answered it on the chat. But I think another one that came through, let me just pull up, in the submissions before the event, was that
yes.
Aside from COVID, what do you think has been disruptive recently and resulted in innovation, different ways of doing things? So I think, you know, we're all quite sick of hearing about COVID. So yeah, maybe Preeti, can I send that one your way? So what else has been disruptive recently?
Yeah.
Oops. Can you repeat that question? Sorry, I was scanning the chat while you were...
What else apart from COVID has been disruptive recently that caused...
I think the biggest disruptor is the elephant in the room. So we, at the onset of this new decade, Jan 1st, 2020, I sort of got up and I was like, yeah, this is going to be the decade we tackle climate change as a problem, as a real existential threat to our civilization and society. And And then, while obviously that was, the Australian fires were just, front and center at that time. And then COVID hit. And I just feel like the biggest, and, it's like the entire sort of this decade that was supposed to be this time that we divert resources and money and investments to actually tackle climate change at scale has been distracted. We've sort of distracted from that purpose as well. And rightly so, right? I mean, we're in the midst of a pandemic. But I think in all of that, what I'm concerned about, and which is I think the bigger disruption, is how do we now, with all of the billions of dollars that are being invested as we speak across the world to revive economies, to revive societies, to revive all of the things that COVID kind of shut off, how do we revive the ones that are actually meaningful, that actually take us to that low carbon future, and basically restore our natural environment and all of the damage that has been done? Or are we simply going back to status quo, whether that's beneficial, again, sort of that short-termism rather than long-termism? So I think that is the next disruption. So it's kind of related to COVID, but also not. It's the disruption that this is not the first thing, or the COVID is not the last to impact us. And we have lots of different threats that are going to require a lot of different thinking, and no longer business as usual. So, I'm sort of thinking along those lines. How do we actually bring this collective action that now we've seen is possible at a global level, collective action? How could we sort of channel that to addressing climate change and biodiversity loss and lots of environmental challenges that are in front of us?
And maybe even another question for you, Preeti, while you're talking is, are there any recommended further readings on disruptive technologies that people could upskill themselves on?
I think it's we need to be in sync with what's going on around us, and we need to use and leverage technology as a force for good. But at the same time, I also would want to say that we need participation from all levels of society, right? We can't be, some people are just watching from the sidelines and are left behind because they've not understood how tech works. They don't have a voice at the table. They're not part of decision making. So we need people to understand the good and bad sides of technology so that we can be active debaters in the conversation, not just sort of watch from the sidelines while other people are making decisions for us. So I think from that point of view, we really need to be part of the discussion. We need to inform ourselves. We need to upskill. We need to learn, relearn, so that we can then manage this future, because otherwise it will be written by somebody else for a different purpose and different outcomes. So I think from that point of view, we need to look at disruption. We need to be part of the conversation. So whatever that takes, whether upskilling, learning, reading, just meeting other people who think differently from you, and all of those things.
Well, I think tonight's a great example of bringing some great brains together and asking some big questions. I certainly know from a personal perspective that was one of the things I really enjoyed about lockdown, is there were so many fireside chats, panels that I was able to just join in my own time and just really enjoy hearing from other people. So I know that also Frances, our founder, she said that, as New Zealanders, we're not great at upskilling, particularly later in life. We sort of do our degrees, think we've ticked a box and that's it. But in fact, we need to continue to keep learning, and I guess surround ourselves with people that have different skills, as Will was touching on earlier, to ourselves, so that we can be stronger together. Yeah. Now I'm very aware of time, so we're just on 8 o'clock. Are there any other questions from people who are on the call? So we've got 50, 59, 58 people on the call. Anyone, if you pop them into the chat.
A couple more that have come through in the chat. So is there an end game to disruption, like some kind of ideal state we could reach? Mandy, maybe you could answer that one. Or society, or the rest of it says, or is society so dynamic that we will continually need to disrupt for generations? Good question.
I think I've looked at that, Anita. I think it's a great question. And I think we changed the way we term things. But if you think of, if I think of the human race, could you agree that there's always been some kind of disruption around, sliced bread? I remember when that happened. I remember when email first came in, and thinking, no one will ever do that. It's just way too long a thing to remember. Like, yeah, I think my answer to that would be yes. I think maybe whether we call it disruption or not, or whether we call it change, or whether we call it improvement, or whether we call it something, I think as human beings, we're always, it seems, wanting to improve things. We've always, technology's evolving beyond us in lots of ways. So your question was, is there an end game to disruption? Yeah, I'm not sure. I don't know what the answer is. I'm not sure there's an ideal state. Yeah, I'm not sure that's a satisfactory answer, but
So maybe Will or Preeti, did you want to jump in and put your view on that question?
Yeah, I think disruption is going to be the new norm. So that's what I think is going to happen. So I guess almost picking up what Mandy said, and I think the pace of disruption is going to speed up. So that's why it's going to become the new norm. So that's what I'm anticipating. And certainly when I talk to my 4 adult children, I said, get ready for that. So it's quite an interesting conversation to have with kids in their 20s at the moment around just what world they're going into. So I do think disruption is the new norm. I also think that context for New Zealand has got a global lens to it as well, right? It's not just about New Zealand now, it's about thinking global as well in terms of opportunities around disruption.
Preeti, any thoughts on that one?
Yeah, I think just echo what Mandy and Will are saying. I think, disruption is going to, it's the challenges that arise with every society, with every, technology, with societal shifts. So much change that's happening around us since we're a much more connected global society, that we're impacted by not just what's happening here and now in our geographies, but around the world. So we're literally, we are not immune to any disruption happening in any part of the world. So absolutely, I think it's just changing rapidly, and the rate of disruption, as Will says, is what's causing the upheaval. So I think it's here to stay.
Excellent, thank you. Any other last questions there, Britta, before I close us off?
There was one about self-awareness. So this one's for Will. So Mandy talked about self-awareness. For Will, what was the process technique used to determine the strengths?
Yeah, there's a thing called the Clifton Strengths Analysis, and you fill in a whole lot of questions and it comes out with your 5 top strengths and then next 29 below that. It's just like an online type strengths analysis that's well proven around the world, but it's just how you apply that to building a high performing team that's cross-functional and agile is really it. So yeah, standard tool if you get where I'm coming from, but then it's how you apply it to being a high performing team. And interestingly for you guys, the rest of Spark isn't interested in it. So it's quite an interesting place to be disrupting there too.
Excellent. Okay, right. So I just wanted to obviously thank all of our incredible panelists that we've had on tonight, and appreciate everyone who has joined the panel or the session between 7 and 8. Can often be a tough time with trying to get children to bed. So very quickly, I've just got a very short video to play around the importance and why we need change for good. And then I'll close us off. Oh. So we do have another session with a new title next week. So what does leadership for good look like? So if you jump onto our website, and we'll do a follow-up email from this as well. That's a morning session, breakfast session, 7:30 to 8:30 next Thursday. And then following that, we will actually have an info evening, meet the team to talk more about the Leading Change for Good program, if anyone is interested in that as well. And lastly, if anyone needs to talk more about Leading Change for Good, then my details are here and they'll be in the follow-up email as well. More than happy to do that. So once again, just many thanks for everyone for joining, to Mandy, to Preeti and to Will. Thank you very much for your incredible insight. Great experiences there, and thank you for being so open and honest and candid with us. It certainly helps when you're running a panel to really have the experience and the depth in there as well. So thank you. I'll just finish up with a karakia. Ka whakaira a te tapu, ki watia ai te ara, ki turaki whakataha ai, ki turaki whakataha ai. Homie, huie, tai kia. Thank you, everyone. Enjoy the rest of your evenings.
Good night, everyone.